Awesome. All right, everybody. Thank you for joining us for today's cardiac rehab work group presentation. My name is Emily Bear, and I'm one of the site engagement coordinators with MVC. It's my pleasure to be facilitating this work group with you today. All right, to start us off, just a couple of housekeeping notes. First, this work group session is being recorded. The slides and the recording will be made available to you following the conclusion of the work group. Next, we will be holding questions until the conclusion of the presentation, but please feel free to add any questions as they come up throughout the presentation to the chat. We'll be monitoring that, and then we'll host a designated Q&A session at the end of Cera and Kelly's presentation today. Lastly, your feedback is very important to us. At the conclusion of this presentation, we will provide you with a link in the chat for the post-work group survey, and we would greatly appreciate if you can complete that. It will also be in the follow-up email if you happen to miss that link in the chat, if you're joining us by phone, for example. As a reminder, for hospitals participating in P4P, you will need to complete the survey to receive credit for participation. Additionally, we ask that you try to be present for the work group for about 80%, at minimum 80% of the work group session. All right, let me just pull up my bio notes here, and I will introduce our speakers today, Kelly Kinney and Cera Bigelow.
Hello.
All right, so Cera Bigelow is a certified clinical exercise physiologist with about 6 years of experience at Corewell Health East, Farmington Hills. Cera received her bachelor's degree in exercise science from EMU. Alongside her fellow coworkers, Cera has had great results guiding and motivating patients who have experienced cardiovascular incidents throughout their rehabilitation. This includes exercise education, as well as nutritional and mental health guidance. She is a wife and mother of 2 children. Her interests include reading and spending time with her family at their cottage in northern Michigan. She also enjoys volunteering at her children's school. Welcome, Cera.
Hi, everybody.
Kelly Kinney is a registered nurse with 7 years of experience at Corewell Health East, Farmington Hills. She received her ADN in 2017 and her BSN in 2021. With the help of her coworkers, Kelly has helped make the cardiac rehabilitation department a successful and fun experience for her patients. By treating patients like family and friends, she's been able to develop lasting relationships with each patient and has positively affected their cardiac journey, I'm very sure. Kelly and her husband, Jeff, enjoy fishing and traveling about the great state of Michigan. They have 2 grown kids, Gregory and Eric, a chocolate lab named Tucker, and she also enjoys crafting, quilting, and being outdoors. Welcome, welcome. All right. With that, I'm going to pass the torch over to Cera and Kelly to start their presentation. So I am actually going to stop sharing my screen and allow them to share their slides.
Hi, everybody. Let me just get our slides pulled up real quick. Share. Okay. Can everybody see us again? Perfect. So we wanted to put in there, we do have no financial disclosures for this presentation. First of all, I just want to thank everybody for coming and allowing us to do this. We really do love our job, and the opportunity to do this for the hospital has been great. Kelly is my coworker, and we're pretty much married to each other, and we really love our jobs, and we just want to thank everybody, especially Stacy for helping us get involved in all of this, and Catherine for putting it all together, and MVC for helping coordinate everything. So with that, we'll get started with the hospital's mission and values here. Corewell is here to improve health, instill humanity, and inspire hope for everyone. Their vision for the future is to make healthcare simple, affordable, equitable, and exceptional. I think we instill a lot of the values that Corewell as listed here, just in cardiac rehab alone, compassion, collaboration with other departments, clarity, curiosity, and courage for our patients and staff. Let's see who we are, where we are for Corewell. We are everywhere from Ludington to Trenton. And Kelly was just in Ludington a couple weekends ago. So we're proud to be part of the Corewell Health team all over the state. Over 65,000 team members, 300 ambulatory and outpatient locations, and 21 hospital facilities. Farmington Hills alone is a 305-bed teaching hospital with level 2 trauma status. Fairly good size hospital, a little bit smaller than our Royal Oak and Troy locations, just a little, but not just a teeny tiny hospital either. So I think we do a pretty good job here. The goals of this presentation is just to really move forward with developing ways to improve patient care by decreasing the amount of times the patients come into the hospital, especially after they visit cardiac rehab. We hope they don't have to come back again. We provide a lot of patients with education as far as nutrition and mental health awareness, and of course, cardiac health. Hopefully by providing all of their proper nutrition information and cardiac healthy lifestyle information, we decrease their readmissions and improve overall their mortality rates. By providing the education that we've been providing as of late, we have hoped to increase the mean number of cardiac rehab visits, and at the same time decreasing the days from their event, once they have their heart attack, to when they can first get into cardiac rehab. We don't want that to take too long. Less than 90 days is our goal. Other than that, what we here at Farmington Hills have been utilizing recently is this cute little heart failure cart, we call it, or heart attack cart. We implemented this about 2.5 years ago into the hospital. It was actually Kelly's, she was the first one to start doing it, actually. We take this cart that has pamphlets on it for patients that have been readmitted with heart failure or they have new onset heart failure. Any patients that have undergone PCIs, they get a little visit from us with our cart, and we pass out scales that are provided by the hospital to the patients so they can weigh themselves every day, as well as the pamphlet that provides more instruction on monitoring their sodium and their weights daily, and just what heart failure is. Some people don't really get a lot of proper education, I don't think, in the hospital. So having us come there and provide what we are and what we do seems to have helped out quite a bit.
Actually, quite a few of the patients, when we go see them for an MI, they don't realize that that is a heart attack. So sometimes they're like, you're telling me I had a heart attack? Yes, I'm sorry.
So yeah, we also pass out pamphlets regarding starting cardiac rehab to the patients as well that have had the PCIs. One of the downfalls we've seen with patients receiving information after they have an event is they don't get the phone number to the cardiac rehab right away. They don't get information about what cardiac rehab is. So having something that says, here, this is who we are, call us when you're ready, instead of waiting for us to call them, it's really been a lot of help. And Kelly here started working down in our cath lab, and she's kind of been our cardiac rehab liaison down there right after the patients get out of surgery. So that we started almost 2 years ago now. So
yeah, a year ago I started down there.
Okay,
but it helps because I can go, especially if it's my patient, telling them about cardiac rehab, and then they actually see a face that they know, and they want to come back because they feel a little bit more comfortable. There's not so much unknown.
So since we started doing the heart failure and the MI cart, these are some of the pamphlets that we provide and information for the patients when we see them in the hospital. We try to get out daily to see these patients with the list that we receive from the hospital. With our changeovers that we've had lately, it's been a little bit less than that. But this is a app that I have found personally from my family members that have used this to track their smoking habits. It's amazing. It's wonderful. I have a few patients that use it now. It helps you track how often you're smoking and encourages you to decrease that amount. You can actually set goals as far as financial goals. If you're spending, you know, $9 or $10 on a pack of cigarettes, that will transfer if you don't buy one. It adds up for you to actually help complete your goals. I've had people that wanted to buy a new dishwasher. So they set a goal on how expensive the dishwasher is. And with all the money that they've saved not smoking, now they feel more comfortable buying that dishwasher. So it's really motivating. It sets you little reminders and things like that. It lets you know how much by quitting your heart percentage, how much better your heart's doing, your lung improvements and everything. It lets you know how much better you're doing just by quitting smoking. Another form we fill out that we found from American Heart Association, just simple cardiac rehab, heart attack discharge papers, who you're going to be following up with after your hospital visit. You know, when patients have this form in front of them that says, this is who my doctor is, this is where my appointment's going to be, they're more likely to follow up and actually go through with that appointment, we have found. So there's a space here where we can write down clinics nearby that we would recommend if the patient already doesn't have a cardiologist. And along with this sheet, there is different other information as far as mental health too, and knowing the signs and symptoms of what you're going through so it doesn't get worse. This one we created over time just to help the patient put into words how they're feeling. Some people might feel dizzy, but they don't really realize it. So we send out these forms too in the heart failure packet. The green zone obviously is where you're going to want to be in. Once they get to the yellow zone, feeling lightheaded or dizzy, starting to have trouble breathing. We tell them if they gain 3 to 5 pounds in 3 to 5 days, that's when they should call their doctor. And other than that, the red zone, obviously we don't want to be in, but they know the signs and symptoms to head to the nearest emergency room if needed.
And that's what we tell them when we give them this packet, is our whole goal is to keep them from coming back into the hospital. So they can call their doctor and try to stave off any other symptoms that they might get and prevent another hospitalization.
Another form we hand out with our heart failure brochures is this. Looks like it needs a little updating, but it's a nice colorful sheet that shows people where to look for different signs and symptoms, and also tells people what to look out for.
Yes. Easy.
I have a neighbor that just got diagnosed with heart failure, and I asked her, you know, do you mind, what medications are you on? Are you weighing yourself every day? How much water are you drinking? And she said, nobody told me to do that. So it's really important. I feel like I want to bring a pamphlet home to her. But yeah, so a lot of people don't know when they leave, they get so much information from the hospital system when they're here that having stuff to take home and read later on is super helpful, I think. But that's another form we have. This is one of the cardiac rehab specific forms for patients that might be able to complete cardiac rehab. Another one that we just found from the American Heart Association explaining what cardiac rehab is. A lot of people seem to think that it's a very intense exercise program and that it's going to be harder than what they can do. So
it's either that or they think it's one visit.
Yeah.
And they've been rehabilitated.
Right. So we have to let them know it takes, you know, 3 months to complete the program typically, if not a little bit longer. But this is another one of those forms that we use to explain our program. Does anybody have any questions so far?
Oh, we're waiting till the end.
Oh yeah, that's right. Sorry, we're waiting till the end.
They'll type in the thing.
Sorry. This is the backside of that form, just a little bit more about the rehab program, and to let people know that they need to check with their insurance and whatnot to see if it would be covered for their diagnosis. Unfortunately, some diagnoses aren't insured, so we try and get people a head start to call and make sure it is. Oh, this is Kelly's.
This is my
Forte.
forte. See, we finish each other's sandwiches. So some of the things that we try to do to keep our patients engaged and excited about coming, we do spirit weeks. We get matching shirts. We try to build a camaraderie because it's a family. When I first became a nurse, I said I wanted to do hospice because I really wanted to be able to build relationships with patients. And I stumbled upon cardiac rehab, and I'm like, this is even better because instead of helping them with their ending, I get to help them with a new beginning. So this is just an example of one of the spirit weeks. A lot of times we do our own. Sometimes the hospital will do a spirit week, and it's nice because you'll go downstairs and see everybody dressed up in the same way. But most of the time it's just us. So when we go down for lunch and we're all dressed up, because we don't just wear a t-shirt or a headband, we go all out. So yeah, and a lot of times our patients will even bring like a family member because they get excited about what we're doing and they want to share that, which is even better because then you have like the family buy-in. Let's see. Oh, we do we have a private Facebook group that any of our patients, past and present, can join. I love this because for our past patients, it keeps them connected to us. If they have questions or even if they just want to reach out and still know that we're there, they have that. And we share a lot of pictures from our spirit weeks and the goings on that happen. You have to be approved in order to join the group. So not just anybody can join the group. It has to be somebody that is actually participated in or will be participating in cardiac rehab. We also have used it like if we used to have snow days, but we don't anymore. But if there was a change in the schedule, we could post it on Facebook. It's just another way that we can keep in touch with our patients. And then this one actually mentions our ticker talk, which is something that we initiated. Well, we had done it before COVID. Mm-hmm. And then we stopped for a little bit, but we were getting so full. We had a lot of patients that were a phase 3 that wanted to stay. Like they just didn't want to give up coming to cardiac rehab, which is awesome, but we're a very small facility. So we were getting too full and we had to get them to graduate and exercise on their own. So we thought, well, we could use this ticker talk. So that way, if they want to stay engaged with us, the third Thursday of the month, we have a luncheon. Everybody brings their own lunch. A lot of times people will bring things to share and they get to have lunch with Cera and I. That's the best part. That's the best part. Yeah. Snacks. But it's also good, like if they have questions, if they want to, a quick blood pressure check or anything like that. But we are planning on, I have a couple of cardiac fellows that are interested in doing like a lunch and learn type of a deal. So they will actually be able to like have a little seminar during our lunch. But so far it's been just pretty informal, catching up and seeing our patients who've become friends.
Yeah, we definitely wanted to start doing something because we find that a lot of support groups for people that have had cardiovascular events are few and far between. If you look up the Mended Hearts chapters, they're not, there's not one in every county even. So, this is something that going forward, it's kind of like a little pet project for us. If, other people from other cardiac rehabs nearby want to start coming and we make it bigger and better, that's something we're totally open to doing. I wouldn't mind having people from our other, sites, come in, and if we get something more solid going, and doing some more education and stuff that way too, just to keep people mindful of that. But social media has been really great for our patients to help each other out and make sure everyone's staying on goal there. This is some of the pictures from there. Some of our meetings we've had.
Yes, the one on the left is a ticker talk. And Laura is actually standing next to me. She is the nurse now that is taking over doing the heart cart and going and seeing all the CHF and MI patients. And these are just 3 of our guys. The one gentleman had been coming for over 3 years. And wanted to still keep coming. The longest I think we had was Val, and he was at 4 years. He was a little over 4 years, but we had one patient that was here for 12 years.
Yeah, before COVID, they had a patient that came for 12 years paying monthly.
Yes.
So yeah, we love having everybody back and seeing everyone drop in, especially on Spirit Weeks, like May the 4th there. And Kelly.
This was May the 4th, Star Wars Day. I actually had a patient bring in a working lightsaber. It made noise, so when you hit it, it was like whoosh. Did I do that sound okay? Yeah. And it was fun. So me and Cera both posed with it, although her picture's not there, just my goofy picture. And then we actually had one of our patients running with it over his head, like on the treadmill. I've made up a little video and posted it on Facebook of everybody who participated, and it was fun. But we do a lot of spirit days. One of our patients just made up, okay, Thursdays is red shirt day. So anybody who wanted one of our cardiac rehab, we've got the beat red shirts. We ordered one for, and on Thursdays it's just red shirt day. Yep. So,
since doing all of these things and implementing, our Spirit Weeks, of course, and all the fun stuff with the heart failure cart, on the next slide here is a couple of our measurements that we've had since starting the heart failure cart, and since Kelly had started down in the cath lab, kind of recruiting patients. The way we track our patients in the beginning was through the spreadsheet. We try to track our initial phone calls since their event, how long it took them to get into cardiac rehab from their event date, from their referral date even. Some patients like to hang on to those referrals and not come in for a few more weeks. But this gave us a good way to track how many days in between the first call from the event was and getting them into orientation. And props to my husband, actually designed this spreadsheet for us and had us using it. So that's the way we were tracking our patients before we went to go live with the new Epic ecosystem. Going forward, we'll see if we keep it this way. I think we should be able to track it through Epic now. So
I'm kind of excited to see, like, yes. I think it'll give us even better data.
This is something else we track frequently with our patients, and anybody else that works in the cardiac rehab realm would know their MET levels increasing from their first initial visit. We want a 40% increase to that ending visit MET level. They get typically 36 visits with cardiac rehab. We try and get them to increase that 40% in intensity and exercise during their sessions. Not everybody makes it. We have some patients that stay at one basic level the whole time. We encourage them to do more, but little Aunt Betty sometimes doesn't want to work up a sweat. So that's just one way we track the progress with our patients over time through their visits. And these are some of the things that my friend Miss Emily showed us, which me and Kelly, we weren't familiar with these in the beginning. We know we're doing okay, but we don't know how well we're doing and if we're improving or anything.
I know, I love it though, because you can actually see it right here.
Right. So it was really nice to see these come out since before Kelly started working in the cath lab and before we started doing the heart failure cart there on the left-hand side. from March of 2019 through 2023. The mean visits that the cardiac rehab patients were having was 10. And on the right-hand side, we can see that that's improved a little bit, which is wonderful. And it really just shows that what we're doing is working, and hopefully over time it just gets better.
I love when we have patients that don't want to be here, because you always have like that one guy or the one lady that's like a tough nut to crack. And it's like, I love it. I'm like, it's a challenge. I'm going to make you like us. I'm going to make you want to stay.
Yes. This is another great chart that we were able to see for the first time just a few weeks ago from March again of 2019. The mean days to getting into cardiac rehab after a heart attack or PCI or that first diagnosis with heart failure to getting into cardiac rehab was 69 days for us. And it's a long time. It's still under the goal, really. But definitely since we've started getting into contact with patients sooner, since July of last year, it's gone down to 52, which is a lot better. And hopefully we've been doing orientations now. We were doing them bi-weekly. I know a lot of sites do them individually. We all kind of do different things. So we were doing them bi-weekly before we had merged with Spectrum. Now we are doing them every week, and it seems to get a lot of patients in a lot sooner. Our flow is a lot better, and we just seem to be having better luck getting patients in quicker.
I'm excited about the new OEE too, because we have like a work queue, and it's got everybody that's got a referral right there. And so you're like checking them off, so hopefully fewer people will fall in between the cracks,
right?
And call us, 9 months later and be like, oh yeah, my doctor told me I should do cardiac rehab.
Yeah. So overall, I think what we're doing is really, it's helping improve patient care quality. I think we're doing a good job getting everybody in, and hopefully we only go up from here. I think my friend Stacy was going to go over our next tableau here.
Yes. Hi. I'm Stacy Karveski, and I worked with one of our developers on building something that was a little bit more real time for the hospitals that chose the specific metrics for their value metric or their conditions. And at first it began as an Excel spreadsheet where we pulled everything and pulled down all the characteristics that MVC does so that we could have more of a criteria, the apples to apples, and be able to see in real time how we're doing for cardiac rehab and for any of the initiatives that we're doing. And it was particular hospitals that chose that we then turned from the Excel into, it was a click dashboard, and now it's most recently been turned into a Tableau dashboard so that our facilities can have a viewing of real time of what's happening at their sites. Thanks, ladies.
Yeah, thank you. Like there's too many lines on that one for me to explain.
And this one is what got the whole thing started. One of our patients, she was actually in that picture of our ticker talk. She's one that's been coming, submitted this to the MICR newsletter, and just saying that attending cardiac rehab at Corewell and Farmington following a life-saving and pivotal or was angioplasty was pivotal for her recovery. She said that the professionalism, which sure, okay, I tend to be a little bit more silly than professional, but that's okay, right? And the personalized approach were crucial in creating a nurturing and safe environment and encouraging camaraderie among patients while in rehab. She not only learned the importance of exercise and a healthy diet, but also experienced a profound sense of well-being. Corewell Farmington's program not only improved her physical strength, but also improved her resiliency and confidence as she recovered from a major heart event. Thank you endlessly and from the bottom of her heart. So yeah, that was awesome. And Katie messaged me, one of our other patients, she's been here with us 2 times. She's had 2 heart attacks. And upon the ending the first session of rehab, she told me that Cera and I almost made having a heart attack fun. And I gotta say, like, that is the best compliment I have ever received. So
Yeah, we really, we've just really enjoyed our job, and we take a kind of unconventional approach. We're a little bit less strict with our patients. And I think that's worked out very well. You know, if someone comes in and says, oh my gosh, I had a double cheeseburger from Bates, Brett, you know, we don't give them a hard time. We understand why, you know, you can't just live your life looking at the sodium content every time. So I think us having a little bit more of a lax relationship with our patients has definitely been on the forefront of why we have such good success. And our patients are constantly asking us how they can do something for us to thank us. And this is actually where this came from. You know, we just tell them, they'll find a survey and mention cardiac rehab, and this is what she did, and this is how we got started, and Stacy found us. So I just want to thank everybody again for giving us the opportunity to do this.
and ta-da,
Questions.
questions. Does anybody have any questions?
Thank you so much, Sarah and Kelly. That was wonderful. You're getting lots of hearts and clapping hands. And
Oh, yay.
it's really wonderful to watch all the emotions kind of coming out throughout your presentation.
Okay. Yes.
I don't know what you're talking about. I have a completely flat affect.
So I'm going to back up in the chat here because we had some questions actually come through in the chat throughout your presentation, and
Sure.
some requests as well, and just general good wishes. So I want to share all these, go through those, and then if we have time to kind of complement Sarah and Kelly's presentation, I was going to review a little bit of the cardiac rehab reports in MVC's registry that they referenced in their presentation.
Sure.
So back to these questions. So we had Catherine actually put this one in. Are any other hospitals on this call using the same resources, handouts, apps, etc., as were presented by Kelly and Sarah? If not, what are you utilizing? So this is more of a question to the group. If anybody would like to share other resources that they're utilizing.
And actually, we just got a brand new resource. They took a lot of our pamphlets that we were putting in a folder and made them into a book. So they actually have like a full color booklet.
That's great.
Yeah. So I think it's got a little bit more information and might be a little bit more intimidating, but it's got the same information in it.
Great. Okay, so nobody out loud, but it looks like couple people are messaging in that they utilize the new Beat handouts. Those are the handouts available through my CR, which I'm actually going to end today with a mention of. But those are some options out there. Looks like others are still working to understand what handouts are being utilized at their sites, since they're maybe new to their positions. But hopefully there's at least a handout being given. It sounds like, you know, handouts, having something tangible to take home. Sarah and Kelly, you found that that was really helpful for your patients.
And I like
Alright.
too that they have a folder that we give them, because they get so much information and so many doctors and residents, and they don't know who's who and what's what with what practice. It's nice that they can kind of keep everything at least in that folder, because I mean, they give you one when you get discharged, but what about the, you know, 3 days that you're here and everybody's coming in seeing you, you know?
Definitely. We did have a request, if you would be comfortable with it, to share the heart failure handout that you were sharing.
Absolutely.
We can talk offline about that. And if it is available, I will include it in our follow-up email.
Yeah, you can email either Sarah or I think our information's in that that last slide. Shoot us an email, and we can email them over to you. We're happy to share.
Awesome. I will include, in case you didn't catch that on the slides, I will include Cera and Kelly's emails in the follow-up email so you can reach out to them directly. All right. Let's see. Laura mentioned that at their site, they recently initiated a liaison role. And they were wondering if you schedule cardiac rehab appointments during the liaison visit. Also, do you have a tracking system for the patients seen face-to-face versus those that actually enrolled? I think you kind of got at that a little bit later on in your slides. But maybe that first question, if you could speak to sort of the timing of scheduling of the cardiac rehab appointments.
Yeah, so we don't at this time have a scheduling option when we go see the patients in the hospital. We kind of leave it up to them. I feel like that saves a lot of kind of weeds out the people that don't really think they're interested. You know, I'm not gonna I don't want to get you all on the schedule, you know, and then have you not show up kind of thing. So it gives them kind of more of a what do I want to say? They're more driven to come if they actually reach out and do it too. And they usually have to see their cardiologist before they see us anyway. So,
but even just doing the initial phone ITP and spending that time and getting all that information, if they don't really want to come or it's just not physically possible for them, it saves them a lot of time and it saves us a lot of time. So I think, you know, if they call and ask for an appointment, that's historically what we've done. I'm not opposed to trying that.
And as far as tracking them, we don't track how many people we see in the hospital versus those that actually come. I know we recognize a lot of people when we see them, but I don't think we track that.
We used to keep a list of everybody that we saw and how many days since their last admission, if they were not new onset. But we've had a lot of changes in the last few months. Our boss that was our boss forever. So there's just been some changes. I think that there probably will be some tracking at some point. Again, I think this new OEE will be awesome for that.
Right. Okay. Another question in here, do you include the family's friends of the patients in discussions regarding cardiac rehab? And how integral are family and friends to the success of cardiac rehab from your perspective?
Especially when we go through the hospital, if family and friends are in the room with them, we have no problem when we see them for education, explaining that to the family and friends too. It's just another person to help keep them on track.
An extra set of ears because
another part of the team. I think that people having family and friends behind them, we actually track, you know, through the patient visits, if they have a social support group that they have behind them. So yeah, family and friends is a big help. It's especially with some of our patients, they need a little more oomph behind them to get here.
And we have a gentleman now who brings his 4-year-old granddaughter with him every time. And she tells me, she's like, Papa drank a soda. And so he's like, I have to be good because she knows what you told her. I'm like, all right, it's not even your wife. It's your 4-year-old granddaughter making sure you're not doing what you're supposed to do.
Oh, that's great. Yeah, good to hear that you have some ways to like integrate family and social connections and everything. All right. Let's see. We're running down this line here. So I believe this is Trinity Health Ann Arbor. We have a cardiac rehab educational video in their learning series that patients can watch on iPads or on the TV while inpatient. And then they also have a cardiac rehab referral and phone number provided on the patient's discharge paperwork. So just some other ideas out there for providing education. Outside of handouts and then the app that you mentioned, are there any other educational like resources that you've considered implementing?
We've been trying, especially with our cardiac fellows, to figure out a way. I know some of our other sites have, we call them dot phrases that the physicians will put in to contact cardiac rehab. Not everybody has that. They just say, oh, they'll call you, you know, when they get your order. We don't always get it. So I think having, what she had mentioned in that comment was having the phone number for us on their discharge paperwork is huge.
Yeah. I know. And the other thing is, like, I've heard the docs being in the cath lab say, you know, they'll give you a call, you know, and if you don't hear from them in 8 weeks, you know, then give them a call.
No,
Like,
we've just missed 8 weeks.
No.
Yeah.
So I tell the patients that I actually am working with, I'm like, listen, when you get home from the hospital, you call this number, you tell them that Kelly was your nurse and that you want to get on the orientation wait list now, because it might be 4 weeks from now, but in 2 weeks, when you have your follow-up appointment and he gives you the green light to go ahead and exercise, you only have to wait 2 weeks for your orientation instead of a month.
But as far as educational, we're open to all different varieties. We keep asking for a TV. Maybe we can play educational things over the TV in our exercise room. But yeah, that's it for that, I think.
And we've got some kudos in here. Tina said, your passion, energy, and dedication to patients are truly inspiring. Your work is amazing and is undoubtedly making a difference in the lives of your patients. Thank you.
Thank you.
Nicole says, impressive work. This is a very heartwarming message from a patient perspective. Thank you for your dedication and drive to improve patient outcomes. We've got some great works. Thank yous, excellent works, great presentations. Please share the slides.
Yes.
Thank you.
Awesome. Any other questions from attendees? I think I caught everything that was in the chat.
Well, I think we did pretty good. Like, we're at 12:43.
Yeah.
I told her she's gonna have to cut me off because I'm a talker. She's gonna.
Sounds good. Well, I am going to share my screen very briefly and just show those cardiac rehab reports so people know where you kind of went on MVC's registry. If there's anybody in attendance that does not have access to MVC's registry and is interested in that, please reach out to us. We'll provide our email at the very end of the presentation. Or if one of my other team members could drop it in the chat, that would be awesome.
Or if anybody
Okay.
wants to see Sarah dressed up all goofy for, you know, Star Wars Day or any of the awesome Halloween costumes that we've had, I can send you those pictures as well.
Great. Okay, so I'm just gonna share this screen. Hopefully everybody can see this kind of data screen here. Oh,
I dropped my pen.
good. One second. Not sure why that's giving me trouble. All right. Well, maybe we won't do that. I literally was just in here doing this. So, we will scratch that idea and I'm going to share my screen and just review some of the MyCR information that we have to update you on instead.
Yeah, and Emily, while you're pulling that up, I'll just, since we weren't able to do it, which is, I completely understand that sometimes these things happen. For folks, what Emily's referring to are the cardiac rehab reports that were launched earlier this year, and we did a couple of lunch and learns on those. We were going to just refresh everyone's memory on that. So if you are interested and you weren't able to attend either of those 2 lunch and learns that we did, we can definitely meet with you separately and do a quick registry review and kind of show you where to find all of the information that was shared for your specific site that was shared during the presentation. Thank you.
Sarah and Kelly did a great job of using some of the reports that have some benchmarking opportunities in them. So they were able to see where they were kind of aligning with other MVC members. And then we also played around with some of the filters, which I think we forget are available. So we could look at different time points, which is one of the wonderful benefits of MVC's data, kind of extending for quite some time here. All right, so hopefully everybody can see my slides once again. Just wanted to remind you that there is going to be one more MVC cardiac rehabilitation work group in 2024 that is slated for November 21st. Once again, it will be at noon. We are looking for a presenter for this work group. So if you or somebody else from your site is interested in presenting at an MVC work group, please get in touch with us. I think Cera and Kelly made it look really fun today. So hopefully that sells you on doing a presentation with us at some point. All right. Additionally, in other work group topics, our next upcoming post-discharge follow-up work group is scheduled for September 10th. That will feature a presentation by Brian Liedeker from Trinity Health Oakland Hospital. And then on September 26th, we will have our rural health work group with a presentation by Brent McCullough from My Michigan Health System. All right. And then here are some of our updates for MyCR. MyCR recently sent out an email to their membership, I think just earlier this week, letting everyone know that they are offering a second round to order free new beat print materials, including 2 new discharge packet sticker designs. So these are stickers that can be added to discharge paperwork to just sort of help patients really zone in and identify that cardiac rehab is something that is being recommended post-discharge for them. Additionally, they have some information handouts on cardiac rehab available, and they are taking those orders for free materials until Tuesday, September 24th. All right. Additionally, MyCR is accepting applications for their utilization quality improvement mini grants. They are opening those, well, they're already open as of August 12th and will be open through Friday, September 13th. Details regarding those applications are available on the Michigan CR website. And some additional details for you here. If you're interested and would like some more information, they will have an information session on August 27th. You can register for that on their website. And generally, there's about $5,000 up for grabs with around $20,000 available. So looking at funding a couple of mini grants here. All right, and lastly, MyCR has a fall in-person meeting scheduled for Friday, November 8th, with a networking event the evening before on November 7th. It'll be at the H Hotel in Midland, Michigan. They are also looking for presenters for their poster session, spotlights, and topic panelists. So if you're interested in presenting at MyCR's meeting in November, you can reach out to them on their website. Awesome. And that is the end of our presentation today. Are there any additional questions that we can help answer?